in the history of the city, and then we had the sunniest March and April in the history of the city. So people were wanting to get outside. They were really feeling, I think, stuck inside of their homes, and there were, as Niloofar was showing in the data, there's certainly a class and socioeconomic status issue here too, where people who were poorer and tended to live in more crowded housing had virtually no access to the outdoors. So initially, when they opened parks back up again, so this is about after a week, what they were trying to do is have a public health campaign to get people used to this idea of social distancing, because people weren't really sure how to even do this, and this involved a few things. So the first was this use of pretty simple and clear images. So like the ones on the left, these signs that were promoting social distancing in parks, they were on the entrance and throughout, any public area. Often minimal use of words, trying to get people used to this idea, but also not relying on English for people who it may not be an accessible language to them. The center picture is showing street markers that were used to show the distance that people needed to be from each other to comply with regulations. These are all over parks. They're still all over parks, on sidewalks throughout the city. And then to make, for parks that were experiencing a lot heavier use, so a lot of them had pathways that went through them, and they were just becoming really congested with bikers, but also pedestrians and runners. So a number of parallel footpaths were created in parks to just sort of expand the range and footfall for people to walk and move around. This was in a number of cities, including most of the cities in London, where they also restricted access to high-risk areas. So they closed things like playgrounds and sports facilities and restrooms. But as our study showed, even with all of this, many urban parks in England may not actually facilitate social distancing. Even these communication messages may not be enough, considering that there's well over 10 million people that have access to a park that is at risk of overcrowding. And I think this is becoming even more the case with stay-at-home regulations being reduced. So this is a picture from Regent's Park in central London on May 25th, so just last week. The government started easing the stay-at-home measures. People could be in parks without exercising. I was in several parks in London. It looked exactly like this. And Niloofar was talking about this assumption of sort of the 4 meters around and all of the park being in use, and these assumptions that were going into the model. And I can say, at least for Regent's Park and two of the other big parks that I was in, it was like every single space in that park was in use except for the sort of water features. It was just full use of the entire park. Particularly during the afternoon hours. So then this question of how to keep parks open and allow people to use them while also to promoting social distancing really has become even more important in these last few weeks. So the question is then, what are some of the policy measures or additional policy measures to consider than what's already been done? So one is to think about dedicated park times for different age groups. We now have good evidence that risk of hospitalization and dying from COVID differs by age group. The elderly and people with other health conditions are at much higher risk. A number of places, including supermarkets, have responded to this increased risk by doing things like having early hours for older age populations. So one could imagine that there's separate times for the elderly in parks, or separate times for families with young children, particularly young children who may not be able to or understand the rules around social distancing and physical distancing. And there also may be, from a safety standpoint, limiting times for bikers or other types of use where you might have people moving at a much faster pace through the park, and that can become a potential issue for injuries or accidents. Uh, Cities can also consider using available data or digital tools to monitor park safety. And there's lots of different things that I think cities around the world are considering right now. But it could include examples like making data available that shows the current footfall of spaces, especially those that are more prone to overcrowding. So some of these parks that are in more dense areas or in central parts of the city. Certainly Montreal would fall into that category in Montreal. Being able to access data and digital tools could allow people to both plan their trips outside, but also choose alternative places or spaces during different parts of the day where they may want to go, particularly for vulnerable populations. So on the right-hand side, that's the UK Parks website, which currently has links to Google, and people can look up, when are the typical busy times for that park. Cities can also use data to monitor the use of public green spaces and make modifications over time. So there may be some parks, for example, that could benefit from additional entry points. So that's been an issue in a lot of the parks in London. They tend to have gates around them. And so there's this sort of bottleneck that forms when people are moving into parks. There may be some that would benefit from having a few additional entrances or even wider entrances into the park. So it's the opportunity for them cities to plan for overcrowding or peak usage times and then apply corrective measures so that it makes it easier for people to physically and socially distance themselves. And then I think that another possibility in really dense population areas is to consider things like e-booking systems. And these can be utilized to help support capacity management of public spaces. So for example, in London, tennis courts and other types of sports facilities and parks were initially closed. Some of those have actually started to open up with e-booking systems that people are using. So that it's enabled these sports facilities to open up before some of the others because of the e-booking. And then of course, keeping in mind through all of this that cities still need to regard their regulatory duties. There's issues of cybersecurity and data protection that come into play. And then obviously also ensuring that everyone has access. I think as we've seen in the US and other places, not everyone has access to a smartphone or internet, and that's been a barrier for things like education for kids. Another strategy is just to reduce the pressure on parks by providing safe areas outside of parks for people to exercise and be outside. I think a trend across many cities is that people are walking and cycling more, but they're doing that in limited green space. And it's increasingly less easy to stay 2 meters apart if you're crammed into a really narrow sidewalk or in many cases, very crowded bike paths. So in London, it's often been the case when I've been cycling that the bike paths are full of bikes and it's really hard to socially distance, but yet I look to the side and there's no cars, which is great. But certainly it's presenting a challenge on social distancing while biking. And so, London has opened up a number of bike and pedestrian paths. And the plan is that this is part of a sort of continued trajectory into the future. So it's viewed as part of this larger long-term effort to rethink the design of cities and improve commuting options for workers and for students, and also combat air pollution, which is a big public health concern in London. Montreal is taking similar measures. So there's many roads that are going to be reserved exclusively for pedestrians and cyclists. I know that's already started a bit with some of the roads in Montreal. And hopefully that'll take some of the pressure off of parks, but then also help prevent an increase in a risk of accidents with motorized vehicles for pedestrians and cyclists. And while I think there's lots of corollaries between the examples from London and what's going on in Montreal and other Canadian cities, I want to talk a little bit about this figure here. So London is a much denser city than Montreal, and a lot of the cities in the UK and England are denser than Montreal and other Canadian cities. But they also have a lot more green space. So this is showing the amount of green space per 100,000 population in the most populated Canadian cities. So Montreal is doing better than Vancouver, but it's doing a lot worse than most other cities and a lot worse than London. So I checked these numbers now a bunch of different times. So it's 2.5 hectares of green space per 100,000 population in Montreal, compared with over 100 hectares per 100 population in London. And this is reflected just by the total land that's allocated to green space in the two cities. It's about 33% of land in London compared with less than 15% of land in Montreal. So these issues of overcrowding in parks are likely to be even a greater issue in Montreal and Canadian cities. So it probably in that case becomes even more important to think about measures to protect health while also ensuring that people have access to parks and exercise and time outdoors. So I'll end and want to mention our co-authors on this, Majid Azadi, Diego Malacarne, and Daniela Fecht. And I included this picture, so this is from San Francisco. And I added it because when I initially saw this picture, I know it made its way around in the media. And I found it really jarring because I think many of us, including myself, are still adjusting to these new norms and lifestyles. And the realization that it may continue for a while. And I think initially my response to this was, oh, this is so terrible. This is not what I want in my park. But the alternative, which we also had here in London, is just to close them down and prevent people from accessing them at all. So I think the more research that's done on this topic in the near term, the better we're going to be able to do in terms of keeping people with access to their local park, and hopefully encouraging efforts to increase the amount of parks and green spaces that are available in cities for people to exercise. And with that, I will open it up for questions.
So this is Daniel Weinstock again. The chat function is open for people to post their questions. So we have asked just to seed the discussion and get people sort of mulling and thinking and percolating their questions. We've asked Professor Nick Luca here from McGill to perhaps kick off the discussion. So Nick, I'll pass it over to you to get us started.
Thanks very much, Daniel, and thank you both, Niloofar and Jill, for that excellent presentation. I have a question that could be very long, so I'm going to try to just give you the short version of it. And I'm interested basically in the multiple temporal scales of policy responses to COVID, because there's the short-term sort of question of how do we manage access to public space, especially parks, etc., when we've got such a high density of people who are potential users, and all of the sorts of entailments and issues that you've articulated in this excellent presentation. But there's also sort of the longer term question of what happens as we draw up schemes for post confinement, if we still need to be very careful about physical distancing. And I'm asking this because I'm doing a lot of work comparatively with colleagues in Sweden on densification and the entailments for the use and the availability of public space and public landscapes. Where, for instance, in Sweden, the Newtown program now basically says, let's get rid of these large tracts of unused green space, which were set up in the welfare state era to provide space for recreational mobilities, jogging, being outdoors, and so on and so forth. Because that's passé, and what we need now are compact cities and all of the closeness that Jane Jacobs and Jan Gehl have argued are necessary for vitality and urban life. So basically, I'm curious as to what you see as the interplay between the shorter term and the longer term policy responses. And very specifically, because what we're talking about in Montreal right now is closing of streets to cars, etc., so that we're rethinking what public space means, because we have so little, relatively speaking, park space and so much demand for public space for people to spread themselves out, etc. So you think we're on the verge, basically, of a significant transformation in the way that space is governed and managed?
Sure. I mean, I can talk about that a little bit, and then hand it over to Niloofar. So I think you actually outlined a lot of the issues in your question, which is quite helpful. But I guess I mean, I can respond to what we've heard from policymakers here in London and what we had seen in the media on this. I mean, I think in the short term, at least in London, the goal was just, how can we keep parks open? So it was just recognized, look, we think this is a really important thing for public health, for mental health, for getting people out and exercising. There was this huge equity issue where, it was all over the papers, which is what turns into and websites, and that makes politicians nervous, which is that the poor didn't have access to the outdoors and the wealthy did. So the poor didn't have, and working class neighborhoods, they were denser, but they didn't have backyards. They didn't even have balconies. There was no way for kids to get outside. And, the wealthy had backyards and nice gardens in the backyards. And so this equity issue became a big concern. And so it was, what can be done to keep them open? And it was really just I think, at least when it comes to the study that we did, it was largely in response to, there was the rules and regulations didn't have a strong scientific foundation to them, right? And so it was trying to contribute to that, because it was, okay, we'll follow the scientific basis for social distancing and the regulations around the 2 meters, and do whatever we can to try to promote that in our parks and green spaces. And that's been sort of, I think, the main, that's been the approach here. And I don't know if I get the sense, at least from some newspaper articles and talking to people in Montreal, that it's been similar. And I'm curious to hear from others that are, attending as to how that might have been different. But yeah, I think for the longer term, it really is this idea of, thinking about what cities are going to look like. Like, it's very likely that traffic may be different, right? If you have people shifting from public transit to cars, or is it an opportunity to try to improve the infrastructure that promotes active transportation? What are the equity implications of that, right? So if you have to have social distancing in transit, for example, and that increases the price of transit, well, what does that do for people who, aren't able to use active transportation to get to their job? And need to still get there, right? So the cost of actually getting to their place of work increases. Similarly for green space, right? I think there's, I know what it was interesting, and earlier today I was on another call where it was more focused on climate change, and people working on climate change are really excited about these potential opportunities, right? Because the idea of really shifting urban design so that it is more sustainable, and we reduce greenhouse gas emissions. So, I mean, I think those are where I see sort of the short versus long-term priorities, which are, short-term, it was just getting people to have access to parks. Longer term, how can we design these cities in a different way? And Niloofar, you may well have other things to add to that.
Yes. So as you said, the crisis became an opportunity to see that we don't have enough parks in London, and there are disparities. There are limited amount of green space in certain areas of London. But London generally is a green city, and we have a lot of green spaces, and a lot of them are private. We have private gardens in London. So people, specific families or the specific residents have a key, and they can use that garden. That these are generally wealthier people. We have school grounds that are green. A lot of them, like the old-fashioned schools in London, they are green, but they are closed to public. But I think in Canada, some of the schools are open to public, so people can use the grounds. So we have some resources that we need to rethink how we can use them because they are there and we can just exploit them.
Thank you so much. I'm going to go on to, we have a few other questions that have come in. One is, do we actually have data on spikes in actual rates of infection when people don't distance outdoors?
I mean, so we certainly have examples of or suspected instances where there was a group of people that gathered, even if it was outdoors, and that was linked to an outbreak, where so there was one person there that is likely sort of patient zero. But I mean, in terms of, so there is some evidence on that. But no, I'm not aware of sort of people looking at how, you know, behavioral patterns and things like that would contribute to the spread of COVID. I'm sure people are looking at that right now, but I don't know of anything. Other people may know who work on sort of looking at the list of attendees. There's a number of people who work on infectious diseases who are on here who may be aware of that literature. Niloofar, are you aware of anything?
No, I'm not aware of any data on this.
Okay, maybe I can just, because that was a very quick question, is there anybody else in the call right now that that has an answer to that question? No, okay. So I'm gonna throw in another one. Any thoughts about the role of cultural or social factors like trust, collectivism, and physical distancing policy? Some data are now showing paradoxical associations between social capital and COVID transmission and deaths, thinking of Sweden.
So I guess how is social capital defined in that? I think this might be Frank's question. Frank, you provide some more info? It sounds because I know Frank's done work on this question. I don't know if this was his or not.
Frank, do you want to chime in?
I'm going to authorize Frank to open his mic and if he's there.
Okay, I'm here. Can you hear me okay?
Yeah, we can hear you okay. Sorry, I didn't mean to put you on this. Actually,
Okay.
really, I wanted to know more about your question though, because it's a good one.
Where it's coming from for the last little while, I've been looking at some data and some papers on social capital, trust, and the situation in Sweden. And just pointing out that even though things like trust and coming together during times of crisis has some evolutionary value to it, it's getting in the way of social distancing policy. And so that might be explaining this correlation that's coming out where countries, societies that are high, like more collective trusts, more affiliated with groups and so on, are actually having a more difficult time in terms of rates of mortality in COVID. This is just one explanation. I can't tell if it's how much validity there is to it. I was just wondering if you had any thoughts about it, you know, as during your walks around London.
Sure. Do you want to go? Do you not want to go, Niloofar, or should I go?
Go ahead, Jill.
Niloofar and I also live in different parts of the UK, so I'm actually curious to what she thinks about this as well. So I think that's a really good question, because I feel like there's so much more to learn about this that we don't right now. Like the part of it is because it's all been happening so quickly, and despite the fact that there's something like 1,600 papers that have been submitted to journals on COVID, I feel like these fundamental questions around, you know, how people behave is essential, but is going to take a long time to kind of figure out what that all means. So I guess, you know, at least here in London, you know, I think when it comes to some of these physical distancing parameters, I mean, I know, well, related to some of the park stuff, I know that one of the reasons why they were, in addition to some of these equity issues and exercise, one of the reasons why there was interest in making sure that parks stayed open and green spaces stay open, is that they were worried that people were going to just stop complying with all of the social distancing regulations, right? Because people wanted to be together. They couldn't go to see their families. Lots of people in London that live in the city have families that live outside of the city, right? So everyone was sort of forced to be separated from each other. And I know that part of this idea of at least giving people a place to go, and you weren't, you're not social in the parks, but at least it's the opportunity to be around other people and have some sense of normalcy and on a personal level, right? So the opportunity during the more sort of stricter part of lockdown, being able to leave our really small London flat and be able to go to a place where there were other people and you felt some sense of normalcy was really nice, sort of speaking to these sort of mental health benefits of having access to parks and having access to being outside. And I think that, the concern was that without those kinds of outlets, people were just going to stop complying altogether, right? Because people wanted to have that interaction. And Niloofar, I don't know if how that sort of relates to where you're at, because you're in a different part of England.
Yeah. So where I live is by the port, and we have access to a forest, a national forest. So I don't go to parks because they are overcrowded and people don't maintain any social distancing. So I have the opportunity to benefit from green space by going to the forest that I live close by. But the other thing that I noticed, that the importance of park is for people in London, for example, in urban areas, in an urban area like London, and also for more disadvantaged people that they don't have access to car, or they have to use public transport to get to places. They cannot just, they are funded to use the park in their neighborhood. Close to in the port where I live close by, after they announced the lockdown, there are boats. The day after, there were no boats. So all the host rich people took their boats and they could go to other natural beauties close by, and they didn't reappear only after the lockdown was eased. So people cope differently with the lockdown stress based on the amount of money they have. This was my experience from a more suburban area.
It's also really interesting to Niloofar, to hear you talk about sort of people's awareness of social distancing. So in London, I mean, people have it down. It's pretty amazing how, any of the park entrances, when you were first, when some of the social distancing measures were first announced, no one really knew what to do, and that's part of the reason why we ended up, they closed parks initially. But now it's the case that people are really good at the entrance or exit to parks. People kind of queue up and wait for, they're waiting so that they can social distance to entrance into the park. Like, you see people waiting anytime there's an intersection within the park to ensure that they're complying with the regulations. And there's pretty heavy policing earlier on. I think on the weekends that still happens here, but people are kind of doing this on their own. And there's really been, potentially because London is just a denser area. And I don't know if it's a result of the signage or just being in a denser area, but the compliance with social distancing in parks is really, really good here. At least in my neighborhood. I live in one of the densest neighborhoods in London.
I think it also depends that the rate of infection is much more higher in London compared to where I live. So you don't think that, okay, you will get the disease because it's not that high. But when you're in London, you always think that you are more cautious about keeping your distance with others.
Yeah, that's a good point.
Okay, I'm going to throw in another question that's a little bit different. Does getting the real-time info about density in parks, does that require everyone to have smartphones? Or how would that be, how might you be thinking of going up that, how that could be, how we could go about that?
I think I can start answering this question, Jill. The only data source that I'm aware of that can provide the use of park is the Google data. Yes, that would be very helpful. We can see how the use changed before the lockdown, after the lockdown, and it gives us a more realistic estimate of the space available. And also we can do some prediction that how much space at like certain times do people need. And of course, it works better if we had that data, it works better with implementing the policies.
Yeah, I mean, it was interesting, at least in writing up some of the results for this study. I mean, there were ideas floated about how to monitor. So as cities are moving forward, you know, and trying to protect these, like what are different ways that this could be monitored beyond sort of reliance on smartphone data, and you know, data that's collected from cell phones. And you know, one of the Niloofar, you can probably talk a bit more about this as well. There are a number of conversations related to the use of drones. And it was interesting because even among, I think, the group of co-authors, there, you know, some were really supportive of this and saying cities haven't utilized drones in a way that they could for public health benefit. Like they provide nuisance and they provide, right now they're not serving a lot of good, but you could think about ways that looking at drones could, for example, help inform crowding. Like if a park is at risk of crowding, that's evaluated with a drone and it goes onto a website, or, you know, you have officials that are sent there to try and regulate use. And I think that's another way to look at doing this. I probably fell in the camp of, I get a little bit nervous when we start thinking about that kind of enforcement. But I do agree that they're probably underutilized in cities and for things like public health and public health management. Niloofar, I don't know if you have anything else you want to add on that.
I think it has also a lot to do with the trust of people in the system and how data is being used. At least in UK, there is always a huge amount of discussions whenever there is an app going on, or like anything related to data creates a lot of discussion. So I think a lot of people don't want to use drone because of the information governance. For example, the NHS app, the health system app that is designed to track and trace people with COVID is not still running in UK, and one of the reasons that people are worried, people won't download the app because they are worried how the information is being used.
Great, thank you. I'm just going to ask another question that's a bit in relation to Niloofar. You were speaking about how the access to, you know, how maybe the wealthier have access to the summer homes or the spaces outside the city. And are there any, you know, is there any talk of increasing access for people who don't have a car to these peri-urban spaces? And I also just wanted to add to that, if there's talk of, say, some really more vulnerable communities having access to these, having access to spaces in, you know, having preferential access or at different times, or so just trying to think about what some of these strategies for getting, you know, either people who don't have a car or aren't quite as wealthy, or, you know, those populations seem to have just much more access to the green space in the parks.
So we had some discussions in the paper that parks are not the only resource for accessing the green space. I mentioned before, people can access the school grounds to use the green spaces there. There are a lot of like other types of green space, for example, golf fields or private gardens, or there are a lot of other private green spaces in UK that in this time of crisis can be shared with everybody and not be specific to certain people with certain socioeconomic status. And that's one of that could be one of the solutions.
I'll just actually follow up on that, because this was something that I learned in the UK, which is that there are all these like really fancy boarding schools and private schools that have massive amounts of green space, you know, former hunting grounds that were used for like fox hunting. And so those were all closed up. And so with not all of them, but there were a number of them that did open up for public access. But related to this sort of equity question, the push to keep just having parks open was really because this idea that people who didn't have access to green space tended to be poor, tended to be working class. And so that was, I think that in and of itself was trying to promote sort of more equity with regards to access to the outdoors and exercise and things like that. In terms of you know, how to make neighborhoods that are denser or low income more green, I think this is what we're starting to see, this sort of short versus long-term planning. In the long-term planning, this is, you know, in London, Sadiq Khan, this is all over his agenda in terms of how to better do that. And I think we're starting to see, at least in the past month or so, you know, different ways of you know, car-free zones, bike areas that are in high pollution parts of the city. So trying to sort of reduce air pollution and provide increased accessibility for some of the lower income and working class neighborhoods. So I think this, at least for London, is the one I'm most familiar with. I think that's part of that longer term vision and plan right now for London.
Okay. I have a question here about whether in London, if cameras are covering the parks at all, and if that data is being used to alert people to overcrowding. Because there seems to be a lot of CCTV or, yeah.
It might be being used. I don't know that I don't know, Niloofar, have you heard anything? I'm sure it is. We may not be aware of it, but I wouldn't be surprised if it was being used.
And I think if they are used, we would never ever have access to that data.
We have someone who made, Leslie Norris, a very interesting comment about, I don't know if, Leslie, if you want to share it quickly about your experience right now in Sweden in terms of social distancing and the parks and some reflections around that.
Yep. My comment was just that I've been in Sweden for about a year now, living and working here. And it's been sort of eye-opening being here before COVID hit and then being here as COVID hit. And also I'm living with a nurse. So that's sort of another spin on things as well. But what's been interesting to me is that it seems part of the challenge is that Swedes have a huge amount of trust in authority and in the government, but it's almost detrimental because the government hasn't really taken a clear stance on what should be done. And they make what come across more as suggestions almost about social distancing. And it seems that because there isn't really a high level of fear, and I think part of it is probably a high level of understanding, that Swedes take that in and they react accordingly, which means that when I've been out, I have seen no social distancing essentially. And it's been sort of reinforced by the fact that schools, primary schools and kindergartens are still open. People can still go to work if they aren't able to work from home. Bars and restaurants have been open throughout the whole thing for the most part. So there's not really anything that reinforces this notion of fear. And because people have so much trust in the government, they're less likely to act more independently and sort of take the information that the government is giving them and assess the risk to themselves and then stay at home or stay in smaller groups, sort of within their family groups. it's been interesting that way, because I think in this particular instance, trust is problematic, or this level of trust is problematic because it almost reduces independent thinking.
Well, and I would imagine that's really interesting. I mean, I think, at least in, again, I talked a little bit about this for London, but at the beginning, like, one of the reasons, again, the reason why parks were closed is that people just weren't doing it. They weren't social distancing at all. Like, people just were not getting it. And it did take sort of closing them down, and then a huge public information campaign. I mean, I'm not sure that the trust is there necessarily, but there was a really, what at least in London, I perceive to be effective public information campaign on how to social distance, because I really do feel like London has it down. But that sounds, again, where Niloofar is, which is not as dense, not quite as urban, that's not the case. So that's interesting that you're seeing this big difference in Sweden, where Sweden obviously has taken a much more lax approach, and hasn't shut anything down, compared with London, which was on full lockdown for 2 months, and we're still have a lot of social distancing and physical distancing measures still in place. I guess actually one thing I'll add, and I didn't talk about this related to parks, but one thing with some of the stricter requirements for parks, so they had opened them back up, but they allowed for, you had to be exercising while you were in the park, so you couldn't be sitting. It really was like the minute you would sit, like we would go to the parks with, I have 2 young children, we go to the parks with them, and one of them sits down, and we'd have sort of the police would come over and say, it looks like your time in the park is done, it's time for you to leave. And so it was really strict, but it also meant that, for the elderly who may want to just go to a park and sit and benefit from that, they're obviously less able to enjoy the parks, or people with other mobility restrictions that can't be exercising lost that access during that period of time. And so I think there's probably a lot to learn, if there is a second wave and we look at having to do this for a longer period of time. I think there's certainly a lot to learn on how to still make parks more accessible for people with disabilities and the elderly and other vulnerabilities.
So we've gotten to the end of the hour. Thank you very much, Jill and Niloofar, for this fascinating discussion, which is hugely relevant, actually, to what's going on here in Montreal, where we're facing very similar issues. The statistic that you cited about the disproportion between the amount of green space available to Londoners and to Montrealers is staggering, and something to think about. It makes our challenge in a way all the greater, and perhaps the urgency of opening up streets, to pedestrians, perhaps all the more urgent, but a lot to think about. So thank you so much. Thank you to everybody who joined on this webinar. This is our first COVID policy IHSP seminar. I just wanted to tell you what the next one would be. I misspoke at the beginning of the hour when I said that we'd be doing them every week. The next one is actually, we'll be doing them every Tuesday as of June 16th, when Marie-Ève Couture-Ménard from the University of Sherbrooke, Lara Khoury and Alana Klein from University of McGill, all 3 from faculties of law. We'll be talking about state power and accountability in pandemic times. So please join us for that. We'll send around reminders, and we'll have 2 more after that. Nick King talking about weaponizing uncertainty in the COVID-19 pandemic, and on June 30th, warehousing the surplus population in times of pandemic, the perils of continuing care, institutionalization of people with disabilities. But we will be getting more information to you about those events very soon. Thank you very much to everybody. Thank you to Jennifer and Anaik for keeping us afloat technically. And hopefully see you all virtually in a little while for the next webinar. And hopefully in the real world in not too long. Bye-bye.
Thanks for organizing. Thanks, everyone.
Bye, everybody.
Thank you. Keep safe.